Good morning. What's going on? Patients ask, what can they do to be better patients? What helps me as a surgeon do better surgery? So let's talk about a few things. Number one, be healthy. For example, take your blood pressure medication. If you're healthy, you follow your doctor's orders, you're gonna have a better time going through anesthesia and surgery. Number two, be fit. Arthritis is awful and it's painful, but don't stop walking. I hear that patients are told not to walk, they'll make it worse. Never stop walking. Ride a bike, swim, lift weights, but be fit. If you're strong coming in, you're going to recover better after the operation. And number three, follow directions. The directions that we give you, and you have my number on it and my PA's phone number on it, we can clarify things. But if you follow directions, you've got the best chance to improve your recovery. That's how you can be a good patient, a better patient, and help me help you.